Bonjour, notre projet se penchera sur l'exploration des expériences vécues par les minorités raciales dans les écoles de médecine au Canada et plus spécifiquement chez les individus noirs.
We will begin by defining systemic racism. Systemic racism can be defined as the ways in which multiple societal institutions operate in interrelated manners to produce racialized outcomes. Despite much documentation outlining racial disparities in access to higher education, as well as health inequities affecting Black Canadians, Black medical students continue to be underrepresented across Canadian medical schools. In fact, Black individuals represent 6.4% of Canadian youth, while Black medical students represent only 1.7% of the Canadian medical class. So, why is this study important? The current literature reveals that minority representation among healthcare providers improves patient care with greater patient satisfaction, reduced linguistic and cultural barriers, and increased service in marginalized communities. However, minority students are faced with a number of obstacles throughout their training. Black students are less likely to find mentors, are at greater risk of poor well-being, and tend to have higher attrition rates compared to their white counterparts. Black medical students also face daily microaggressions and are often subject to mistreatment from peers, physicians, and patients. Of note, most of the current literature comes from American-based studies of medical trainee experiences. Unfortunately, a tendency to avoid acknowledging issues of racism among Canadians has contributed to the absence of race-based data collection within medical institutions.
Donc, notre étude vise à combler ce manque de littérature en explorant l'impact du statut minoritaire sur le parcours scolaire des étudiants noirs dans les facultés de médecine canadiennes. Donc, quelles seront nos questions de recherche? Eh bien, quelles sont ces expériences des étudiants de médecine noirs sous-représentés dans les facultés de médecine canadiennes, surtout dans le domaine du bien-être, de l'avancement professionnel, du soutien institutionnel, ainsi que de l'inclusion et de la discrimination?
Given the gap in scholarly knowledge on Black medical students in Canada, our study will be exploratory and descriptive. We created a 61-question anonymous survey, which was derived from studies conducted on African American medical students and residents, and then tailored to the Canadian medical school context. The survey will cover 5 dimensions. The first, the section on demographics, will provide valuable information on the number of Black students in each Canadian medical school and within each academic year, ethnicity, gender proportions, francophone identity, and socioeconomic status. The diversity and inclusion section will cover examples of social inclusion or ostracization in academic or clinical contexts that Black medical students may have faced. The wellness section will focus on identifying stressors that students face, as well as any sentiments related to burnout and access to medical and mental health resources. Discrimination section will focus on the source and type of discrimination, as well as the effect of experienced discrimination on wellness and any barriers that students may face to reporting racial incidents, as well as seeking and receiving institutional support. The career advancement section will focus on discrimination as a perceived barrier to succeeding in residency matching, as well as the importance of choice in specialty or location for residency as a means to avoid instances of racism. Finally, the medical education section will allow us to learn about the presence of programs promoting diversity throughout different schools, as well as examples of culturally competent curricula.
En termes de statistiques, à la création du questionnaire, une version finale sera déterminée avec le Krupat Alpha qui testera efficacement les domaines visés au sein de notre échantillon de population, approximativement à 130 participants. Nous effectuerons également des analyses exploratoires de corrélation entre les variables démographiques et le score global calculé à partir de l'enquête quantitative. Donc, quels sont les résultats anticipés? On estime un faible taux de diversité parmi les écoles de médecine canadiennes. Les étudiants noirs peut-être reporteront un faible sentiment de bien-être, potentiellement une prévalence élevée d'expériences et de microagressions et de racisme. On estime que le manque de mentorat est le fardeau de la responsabilité présumée dans les initiatives de diversité et d'équité comme un obstacle à l'avancement de carrière. Donc, en conclusion, tandis que les facultés de médecine canadiennes tentent à diversifier leur population étudiante, il sera primordial de comprendre les expériences des étudiants noirs en éducation médicale afin de favoriser une culture d'inclusion et d'équité tout en éliminant les obstacles à leur avancement professionnel. Donc, ceci, c'était une présentation de Johanne, Kian et Lolé. Merci de votre écoute.